We're 8 months into a global pandemic which has upended life as we know it. Nearly every country in the world has been impacted by the coronavirus. Over 18.5 million people have been infected and more than 700,000 people have died. And yet there are still people who are skeptical about the dangers of the virus and others who still don't believe it exists at all. Well, today in the show, we're going to be talking to some people who didn't take coronavirus seriously until it hit them personally. Joining me today, we have Tony Green in Dallas, Texas, Ruben Matter in Stanton, California, and Dr. David Vega in Miami, Florida. So gentlemen, thank you so much for joining us. And you've all got very different stories. So I want to start with you, Tony. So can you just give us a sense before the virus impacted you personally? Paint me a picture of your views. What did you think?
Well, I'm a skeptic by nature. I just like to question things and get to the bottom of it very quickly and determine. And I've got a network of over 3,000 people, and I didn't know anybody that had this. Nobody until I caught it, and the rest of my family suffered.
And when you say a network, Tony, do you mean sort of a social media network or a friend group?
Coworkers, colleagues, people that I've dealt with in person. Large groups, social media, friends, neighbors. I've lived in several different parts of the country, so I've got a large group of people that I stay in communication with.
So, Ruben, it's interesting. So Tony is saying that, he has this large network of people, family, friends, colleagues all around the country, it sounds like, and no one had it. So, he was naturally skeptical about the virus. What was your story?
Yeah, in the same sense as Tony is skeptical, is like, this isn't real. The only, it hadn't hit close to home yet. It was just someone else on the news, and it was, at the gym, people at the gym, they're like, nobody's going to get it here. It's all just made up. It's fake. And that was the thought process before I contracted it. And then I knew it was real. But before it's not real. It's just made up. It's all fabricated. And that's what allowed me not to get help soon, where it went really bad, of just having that mindset of it's not real.
And it sounds like not just that you didn't think it was not real, but that if it was real, it wouldn't affect you. You mentioned the gym.
Correct, yeah, because I train at the gym, work out 6 days a week, eat healthy. I mean, everything was on point, I thought, on the outside, but inside the immune system was low and just very burned out as far as a lot of, I was sleeping like 4 to 5 hours a day because it was this chaotic lifestyle. And that's where the immune system was down and contracted the virus.
And we're going to get to your story in a little bit. But David, tell us a little bit about your story. It's a little different. You were a fourth-year medical student at the time. You knew the virus was real. So why didn't you think it would affect you? Why were you skeptical?
So when the virus started to surface in the United States, I was actually across the world in Africa finishing a 2-month global health rotation. So the media there was not focused on coronavirus. I'd maybe heard one podcast. And speaking of my mom and dad, they kept bringing it up, but it just didn't seem like something very prevalent at the time. And then when I came back to the United States after my rotation finished, it was the first week of March. I was just, as a young adult, very excited to see friends and family that I hadn't seen for months. And within that time period of, just being home before going back to Indiana to finish my studies, I ended up getting the virus. So it just all kind of happened very quickly. And this is all before kind of the social distancing and any of those guidelines started to go into place.
So yours was kind of early on. I want to sort of talk a little bit, Tony, about what happened to change your mind. So, this all seemed to happen for you at the start of June. So walk us through it. What changed your mind?
Well, we had been, in the middle of a lockdown that had started to ease, and Governor Abbott here had set it up into 3 different phases before we would go back to, really normalizing. And we were coming into the weekend of June 12th. And he had come out and said, we're phase 3. We're going to increase the capacity of public places from 50 to 75%. So restaurants, bars, things like that are starting to really open up. We're thinking, we're pretty much clear. And, you know, our family, myself, my partner, we both had our parents over. Mine came from out of state. And we had a really enjoyable weekend. And immediately we all started to experience some symptoms. And it just spread from there into other family members. So the total of 14 of us that caught it. One of us has passed away, and another, my father-in-law, he remains on life support.
I'm so sorry to hear that. I mean, you know, that's just, I mean, it must be devastating. You know, you mentioned there, Tony, as well, that you sort of, it sounds like, let your guard down, in part because of, you know, how the government of your state was treating the virus. Is that fair to say? Would you sort of put the onus on the state and the kind of guidelines, or is it more about, as you mentioned prior, the fact that in your social world, no one was really taking all that seriously?
There is, you know, it's a number of factors. That is certainly one of them, you know, what the leadership was saying, but it was really beyond just the state. I mean, I really want to put some blame on the federal government, you know, and President Trump, which I actually voted for back in 2016. I think that he has really failed to lead in this area because, you know, he's not really practicing the social distancing or the mask, and he's downplaying the severity of it. And I think that comes down to a broken line of communication within the administration. You know, I'm sitting here, I'm listening to my leader, you know, and you know, beyond the network and local government, you know, I'm just not seeing that, you know, the White House is taking it seriously. I don't mean to bash the president. It's just, to me, that's my opinion. I think that he's really dropped the ball on this.
Ruben, what do you think? I saw you nodding when Tony was sort of sharing some of his story there. I mean, you also got sick with coronavirus. You got very, very sick.
Yes, when I was admitted, it was for shortness of breath, and it was very sick. Where the doctor said if I didn't go in there, I wouldn't have woke up the next day because my lungs were so contaminated. So I checked in Sunday afternoon and was already on the ventilator Sunday evening, intubated 2 hours later, induced into a coma, and Wednesday was brought out of it. Then they gave me some antibiotics, loaded me up, and they said I had 40% chance to make it. That Wednesday, put me back into a coma, called my sister later on that evening and said, we don't think he's making it through the night. He's not responding, he's declining. But, you know, Thursday comes around, I'm starting to get better, more positive. Friday comes out, and then that's when they took me out of coma, ran tests, and, you know, the results came back where my lungs were looking better. You know, a lot of prayers out there. Lungs were looking better, and I had sepsis as well. And with the sepsis, they said my white blood cell count was up. So it was 5 days in an induced coma, and, you know, thank God that everything turned out okay. I was able to get released that Saturday because the doctor said everything was good. And I was like, well, you know, what's the reason I'm still here? And he says, well, your equilibrium, you have no balance. You know, you had a catheter and you haven't done nothing for 5 days. So I stood up and I was taking my balance and wanting to get my equilibrium back because that was the only way I would be released. And then I called the nurse back in. And I known the primary doctor for a number of years. We used to work out together. I said, let me go. You know, I'm here. I can do this at home. So, you know, thank God he let me go. And 14 days. But it was very, you know, when he was sharing it, it's real. And the family members that get it. And, you know, and no one could go in and visit you. You know, there's nobody who could go in when you're in quarantine. And the only phone calls, waiting for phone calls, and, you know, for the, you know, prayers for the families who have family members there, fathers, brothers, sisters, mothers, you know, daughters, it's just imagine being at home and waiting for a phone call, and there's nothing one can do of like, I want to go visit them. You know, that was the challenging part of, you know, I didn't see that until after I was out of a coma, and I just imagine the family members that go through that now. And
yeah. Absolutely. Yes. Tony, what were you going to say?
It is hard, you know, it's very difficult. And, you know, my father-in-law and his mother They actually had rooms that were right next door to one another.
Wow.
And she passed away. He was not aware. And I mean, they didn't know they were that close to one another. When I was admitted into the hospital, which was the same day as my father-in-law, you know, we were on different floors. So, you know, I mean, we just assumed that the whole hospital was really full of people like us. So, you know, it was very sad for him to experience that. But, you know, like you were saying, you know, the fact that you can't get any phone call. I mean, you could get a phone call, but you can't go in. You can't be with your loved ones. And, you know, I think about my father-in-law's mother, and I can't imagine having to go through that all by yourself, you know, not be able to have your family around. And, you know, she was very big about her family and a lot of gatherings. And I mean, she loved her children, she loved her grandchildren, and, you know, to have to just check out, you know, without any family around you, it's just, it hurts to even think about it now.
And Tony, I mean, you know, you mentioned that this was a gathering, obviously, that, you know, people came, your in-laws, both sets of in-laws came to your house. Do you feel responsible in any way?
You know, but my family did not really share my views, you know, necessarily about the virus. I mean, skeptical, maybe slightly, but, you know, I feel like I led by the example that, you know, was shared with me. And unfortunately, yeah, it was wrong to do it. But I mean, it was a small gathering. There were 6 of us. It's family, you know, we haven't seen each other in a few months. And, you know, to think that you can't embrace one another, hug my mom, give me a break. Of course I'm going to hug her. I think that you have to be afraid of her and wear a mask around her. And, you know, it didn't really make sense at the time. But, you know, looking back on it, we don't know who had it. I'm pragmatic. You know, there's no way of knowing, and we don't want to know. So, you know, it is what it is. You know, it happened.
Well, I mean, you know, David, your story is a little bit different because Tony and Ruben, they were both hospitalized, as we heard. You weren't hospitalized, but you still got a pretty nasty bout of the illness.
Good. Yeah. So for me, it was the sickest that I've ever been. So I'm 27 years old, and I was probably sick for about 2 to 3 weeks. Mostly just started kind of like a flu, like fever, muscle aches, very fatigued, no energy to do anything. I lost about 10 pounds or so. For me, after a week of still having a fever, things started to get a little bit concerning, and testing was so limited at the time that thankfully I had a doctor's appointment set up where I could get that test. And it took 7 days to get my result back. So in that whole time, I'm just waiting for results, just wrapping my head around all the different things I might have at that point in time. And then I find out 7 days later that I had coronavirus, and I was still feeling the symptoms. Probably it wasn't until 2 weeks afterwards that my fever started to subside. But for me, that was the sickest I had ever been. And, you know, for someone, I consider myself, I try to stay healthy, try to exercise frequently, and it still affected me very, very harshly. One of my best friends from med school actually encouraged me to write a post and share my story, because just a lot of people my age are not taking it seriously. And whether or not they can get as affected as I did, or even worse, which is happening as well, they could definitely be vectors and spread it to other people as well. So I thought it was very important to kind of share that story.
Well, we're grateful to all of you for being here today to share your story, because we know it isn't easy. It's not easy to sort of be, you know, almost mea culpaing. So, you know, it is hard. You know, David, I am curious because obviously, you know, you're talking to us, you've got your scrubs on. You know, you people are going to be watching this episode and they'll be thinking, well, you should have known better. I mean, you're in a position of responsibility. I mean, how do you feel that people might have looked up to you as somebody who sort of was, you know, in the medical profession, potentially believed you were speaking in a position of authority? You know, what do you feel about that?
Yeah, I think that's a great point. For me, it was a lot of switching around. So I was finishing my last year of medical school, and for us, last year is it's usually a big celebration. You know, you're very excited to graduate. You find out where you match for residency. Usually the last few months are, kind of some lighter rotations. And I was just finishing my 2 months in Africa where I did a global health trip, which was an amazing experience. So for me, it was just a lot of switching around, and I got it pretty early on in March. Actually, March 13th was when I got tested. So I started having symptoms a few days before that. And then March 20th is when I received my positive test result. And I remember that kind of right in that same time frame is when social distancing guidelines started to kind of come into play. Even the masks, that was like a big questionable topic, whether people had to wear masks. And now it's almost ridiculous to think about not wearing a mask in public, just because it's just almost the norm at this point. So I guess my response to, people thinking I might have known better, I'm still a person, I'm still a human being. And it's, at that time it was hard to know. I had just known about a few outbreaks. There's one in Seattle, one in New Rochelle, New York. And none really in the area that I was in at that point in time. So I guess almost at that point, until it affects you or a loved one, I think, as Tony had said earlier, it almost doesn't feel as authentic until it unfortunately has to get to that point.
Sort of dialing it back again, just to the immediate reaction that you received. As you mentioned that, you said you voted for the president in 2016. You have a very mixed, eclectic social group. How did people react to you online when you shared your story about the fact that you were a skeptic, you really didn't think coronavirus was all that dangerous, and then you were hospitalized as a result?
No, well, it's funny you ask. I've already cultivated some lasting relationships, I feel like, out of this. But I had wrote a op-ed for a local publication that comes out weekly, and it was not received very well. It's mostly liberal. I'm kind of more conservative to kind of center line. And, the fact that I had mentioned that I had voted for Trump was not in good favor with the general audience. So a lot of people were turned off by it. I was called everything from, negligent to a murderer. I should commit suicide. I mean, there was some really, really hateful, nasty responses. I single-handedly crashed the website. This was my first op-ed, for a news article, but I guess it just drove so much traffic and international interest that it really created quite a stir. And like Ruben, I speak a lot, and I'm trying to use my influence in a way where I follow my sword. I admit my failures, but I also bring about awareness with it. And it's unfortunate that some people are as vile and hateful as they are, but you just take it with a grain of salt. You can't win over an entire audience, and your message is for the ones that it impacts. The others, it's just residuals. So they're not residuals, but collateral, I should say. But that being said, I put together a website that's got the article, and it's called theopiniontable.com. And it's got the article that I had written, and it's also got a timeline of events for how the 14 of us were impacted. So it's real detailed.
I'm curious, why did you think the timeline was important? Did you feel like why did you feel like you had to go into detail about specific dates, timelines, and that kind of thing? Who was that for?
I also write for a living, so there's a little bit of I guess just those details matter to me when I'm writing like a book or something. So when I did that, I was doing it for not just an example of how this spreads, but how it impacts the family, and how people can contract it without even realizing that they've got it, and they're passing it along before anybody even really realizes their symptoms. And the incubation period for these different strands is also varying. So the fact that we were together in close proximity, went away from one another, and then started to feel these symptoms, we're passing it along to other people along the way. And I mean, this all transpired, the 14 of us, I would say, within about a 2-week period. And the majority, I'd say 9 of us, got it within the first week.
Wow. Well, I want to bring in Lindsay Leininger right now, because Lindsay's been listening to the discussion. She's a public health scientist at Dartmouth Institute in New Hampshire, and she's done a lot of work around communication when it comes to coronavirus. So, I mean, Lindsay, first of all, I mean, you've been listening. What do you think? I mean, has this been informative in terms of how you bridge the gap between people who are skeptical about COVID and then, come out the other side?
Carolyn, thanks for having me. It's great to be here. So I want to echo something that Tony said at the beginning, and actually it's a thread that we were talking about in the Zoom room beforehand, that it's really important to trust but verify. That old saying applies here. So while you can trust that your social network, whether it be 30 people or 3,000 people like Tony's, has your best interests at heart, you can't really trust that their information is accurate. You must look beyond your social bubble to get some better information and some verification. So we never, and you hear Dr. Fauci speak about this, we never ascribe bad intent, right? And we learn this through these powerful stories. They're all well-meaning people, but unfortunately our brains are bad at decision-making under uncertainty. And so the way we can best protect ourselves is to trust our social networks, but verify with news sources outside of them.
Yeah, that's a really good point. Ruben, what do you think about that? I mean, is that something that you were engaging prior to getting coronavirus? I mean, how much did you vet the information that you were getting from people about it?
It was the information that I was receiving is like she, Lindsay was saying, credible resources, because, it's all, we only know what we know. And the way our mindset is the closest person, the guy at the store, my friend's friend had it, and this person said you can't get it anymore, and all of these things. But there's so much out there of credibility, the news, Google, YouTube, there's so much information that's credible, and only allowing oneself the limited information of one's network, their friends, and going by it, I feel it's detrimental to one's health if they continue to go that route, because it's all, well, they said, but there's documentation beats conversation. That's the thing.
Yeah, Tony, what do you think about that? Has your sort of brush with the virus, has it changed how you consume information?
Yes, it definitely has. To Ruben's point, and also Lindsay's, this is a learning curve for everybody. So a lot of this is just hypothesis in the beginning, and I feel like we're still in the beginning stages. We're still learning about this, and as it continues to develop itself into new strands, you're learning. So the entire medical industry at this point, they're still struggling to find out the facts, compile a bunch of data, and come out with something that they can communicate to us that makes sense. And sometimes that information contradicts itself from where the beginning stages were to present time. And unfortunately, a lot of people like me that are skeptics, they'll look at that in the beginning and they'll say, yeah, there's something wrong here. There's misinformation. They don't know what they're talking about. So, why should I trust them? I'm going to go and I'm going to explore my other sources. And, some of those other sources, unfortunately, here I go falling on my sword again. Some of them are just keyboard warriors. They're armchair doctors that have no medical degrees whatsoever. The Alex Joneses of the world, that are conspiracy theorists, and you're just sitting there going, wow, to think that I went down that rabbit hole with some of them. It's embarrassing, but it's important for people to realize, we are human. We do make mistakes. When you're stuck at home, under house arrest for a couple of months, you start to get a little weird.
Tony, may I riff on that?
Yeah, go on.
Is that okay if I riff on what Tony had to say? I really want to lift up his point because it's important that we are all doing our best, but we science is a method, not a stable set of facts. And so the scientists that you shouldn't trust are the ones who don't update in the face of a lot of uncertainty. And we in the medical field and the scientific field have to get better about communicating uncertainty, that science is a method, the body of facts will change. And that is on me and other people to communicate that better.
what would you say to people who still think, I mean, 155,000 Americans have died as a result of this virus. Over 700,000 people around the world have died as a result of this virus. What would you say to people who still think the way that you did, Tony, Ruben, David, before you got ill about the virus? What would you say to those people now, Ruben?
Get information, get credible information, and read up on it, or get information on it. Get resourceful with your resources, credible resources, and wash your hands, social distancing, and wear your mask. Those are the three. That's what I'd say. And be aware that your loved ones around you. Let them know you love them, because tomorrow we don't know what could happen with this virus going on, and life.
Yeah, Tony, what do you think?
Well, first of all, don't be a fool. Learn from people that were skeptical, like myself, that made some, choices that were innocent but became foolish and resulted in the loss of life. People that are, clinging to life, and people that just suffered in general. And we don't know how many people may have been infected outside of the family that we've just come into contact with. It, like a pharmacy or a grocery store or something like that. It's extremely severe. You should take it seriously. Rethink your social schedule this year. I know it really sucks to miss a pool party in the summer, or to maybe miss a family reunion or something like that. But, there's a lot of risk involved, and, you don't want to pass it on to family. You don't want to pass it on to friends. You don't want to pass it on to anybody. This is extremely, extremely serious. Let the medical experts and research take its course so that we can combat this, fight this, and, be able to move forward maybe next year with better results, better outcome.
Yeah, David, and final word for you.
I think the biggest thing is that your health is truly a blessing, and you can't take it for granted. For me personally, being young, healthy, with no predisposing factors, that didn't prevent me from getting COVID. And hearing stories like Ruben, who was on a ventilator and now extubated and recovering, that's a miracle, to hear that type of story. And now, especially being on this side, seeing patients come in, 50s, 60s, even some patients in their 30s on ventilators. This is real. So really, we have to take our social distancing, wearing your mask, take all the precautions we can, because, tomorrow's not guaranteed.
Oh, I want to thank you all so much, and Lindsay as well, for joining us at the end there. Really appreciate all of your time. Tony, Ruben, David, Lindsay, thank you very much for joining us. And guys, thank you so much for watching as well. Next time on Global Hangout, we're going to be back to busting the myths around coronavirus, so continuing the theme that we started today. So as always, please do tweet us your questions. You can tweet us at NBC News. You can use the hashtag Global Hangout. And until the next time, do stay safe, and you can stay connected.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.